My name is Dr. Frank Vicini. I'm a radiation oncologist for PrecisCa USA. I primarily treat breast cancer and have been involved in multiple studies looking at the treatment of breast cancer with radiation therapy. Short course whole breast irradiation is exactly what it says. In other words, the studies that initially established the equivalence between breast conservation versus mastectomy delivered 6 weeks of whole breast irradiation after lumpectomy. Now, through the years, we tried to determine whether or not all patients required that entire 6 weeks of radiation therapy, or whether or not we could condense the radiation over 3 weeks or even 1 week. Why would we want to do that? To decrease the overall treatment time of the radiation therapy for the patient. In other words, instead of coming back for every day for 6 weeks, we tried to reduce that in half and deliver the whole breast irradiation in 3 weeks or less. There have been multiple studies that have looked at this very issue, both in the United Kingdom and in Canada. And what those studies have conclusively established is that in appropriately selected patients, and we'll discuss what those are in a minute, whole breast irradiation can be delivered over the course of 3 weeks and produce the same cancer control and the same minimal toxicity as the conventional 6 weeks of whole breast irradiation. So nowadays, the majority of patients with low risk features can be treated after lumpectomy with 3 weeks of whole breast irradiation, 3 weeks delivered either in 15 treatments or 16 treatments. Again, it's still the same curative dose of radiation therapy as one would get over 6 weeks, but it's condensed over 3 weeks to make it more convenient for the patient and improve their quality of life. Typically, the patient who would be considered a good candidate for whole breast irradiation, that is shortened or condensed, we call it accelerated whole breast irradiation. It would be a patient with, again, a smaller tumor, lower tumor grade, negative lymph nodes, negative margins, estrogen receptor positive. But even patients who require chemotherapy after lumpectomy are potential candidates. As a matter of fact, we're attempting to increase the utilization, what's the shortened courses of whole breast radiation, because all of the studies, as I've mentioned, have shown equivalent outcome in terms of cancer control and the same low toxicity and good cosmetic results. So the majority of patients after lumpectomy with negative lymph nodes can be treated currently with accelerated whole breast irradiation or shortened whole breast irradiation. As a matter of fact, the most recent studies from the United Kingdom have shown that in some cases, in very selected patients through one trial, the radiation therapy can actually be delivered in 5 days of whole breast irradiation. Now, this is in a limited amount of studies currently, but in the future, you will see that patients will be treated with shorter and shorter courses of whole breast irradiation, again, for the simple reason of reducing the side effects, reducing the time of treatment of radiation therapy, and improving the quality of life of patients.